What's the best Medicare supplement plan for 2024? Plan G. That's easy. Plan G covers the most, has the least out of pocket, and that plan is standardized. So if you buy a Plan G with this company, this company, this company, this company, it will all have the same benefits. They're standardized by law. Price varies, service varies, and the most critical variable is how quickly the price will increase. Some plans go up like a rocket. Some plans go up very slowly. And most plans kind of go like this, but they will go up. Medicare Supplement Plan G is the plan I will buy when I turn 65. I'm only 58. It's the plan I have both my parents on. It's the plan I wish everybody out there could afford to buy. Not everybody can afford to buy it. Not that it's expensive at 65, because at 65 in most states, it's between $100 and $200 per month. And that's a great value. You'll have a deductible of less than $300. And for that $100 to $200 a month, you can go to any doctor in the country, unlike Medicare Advantage, where you can go to certain doctors and certain hospitals, and they're always having negotiations where now you can't go to this hospital, now you can't go to that doctor. You don't have to deal with any of that with the Plan G, which why we call it the Cadillac plan. You can go anywhere. They accept government Medicare, they accept your plan. Now, there are other options besides Plan G. There's a high deductible Plan G. Most people don't buy it. You would pay the first $2,800 of your care this year before your Plan G kicks in. Then it looks just like a regular Plan G. And that might better suit the way you want to spend your healthcare dollar. Like I said, most people don't buy it. The fact that most people don't buy it means the rates go up slower. But that deductible, that $2,800, will keep going up every year. It's tied to inflation. So you'll get to the point where that's going to be $5,000 out of pocket in the future. So again, most people aren't that fond of a high deductible Plan G, except for people in Florida, Southern Florida, and New York. To the states that have the highest priced Medicare Supplement Plan G, they're like, so they go with the high deductible Plan G. Now, the second most popular option after Plan G is Plan N. And Plan N doesn't go up as quickly as Plan G because not as many people buy it, again. But with a Plan N, you can still go to any doctor, any hospital in the country, but you will pay $20 copay every time you see a doctor. So if you're somebody that has seen a lot of doctors for a lot of conditions, it's not going to be economical for you to buy a Plan N. If you're one of those people that like hardly ever go, and a Plan N has that risk that you could get cancer, dialysis, whatever, that you will have to spend that $20 every time, which could make it have been a bad decision to go with an N. And remember, with the Medicare supplement, when you make your choice in most states, you're almost getting married with that insurance company. If I already have some major health conditions and I'm turning 65, I can get any plan from any insurance company in the nation. That's federal law. They can't ask me any questions about my health. I might have stage 3 breast cancer. I can't tell them, they can't ask me. I can buy any plan. Now I'm on the plan, and next year I get a 10% increase. It's kind of standard for next year, 10% increase. And I'd say, ooh, that's kind of steep. I was thinking more of a 4 or 5% increase. I think I'll switch. I won't be able to switch because of my health now. So now I'm going to be with that insurance company forever. And if it's a rocket to the top of the rates, or if it's more gradual, I'm going to hope that I chose a plan that has more gradual rates. And who has more gradual rates? The bigger the insurance company. The bigger the boat, the less you feel the waves being inflation. The smaller the insurance company, the smaller the boats, the bigger the waves. So while we do represent many different insurance companies that sell these Medicare supplement plans, what I recommend to you is going to be different than what I recommend to your friend in another state or your relative in the same state but in a different zip code. The insurance companies price their plan based on location. Men pay a little bit more than women. And when you're first going in, they can't ask you any questions. But after you're in, they can ask you those questions. Doesn't mean we can't change you. You can change your Medicare supplement plan any time of year. So you might be on a Plan N going, ooh, I didn't really think about that. That if I do get sick, I might have to pay that $20 every time, and I might be seeing a doctor 3 times a week, and it'd be more economical for me to take safety in a Plan G. You can move any time of the year, anytime. Just call us, and if you can answer those health questions, we can move you from an N to a G, or a G to an N, or anywhere in between. Medicare Supplement doesn't have a special time of year when you can change your plan like you have with your drug plan, that you can only change, unless you have a special circumstance, you can only change between October and December, the annual election period. So a lot of people don't know that about their Medicare supplements. So if you've gotten some rate increases the last couple of years that you're uncomfortable with your Medicare supplement plan, typically Plan F, that plan's no longer for sale, but a lot of people are on that plan, and those rates are really creeping up there. You can switch at any time of year, and it's better to do it now while you're healthy, because once you get sick, in most states, you won't be able to answer those health questions and change plans. But in general, even though there's all these different Medicare supplement plans, you're really talking about 3 plans. Plan F is no longer for sale. So Plan G, most popular plan. Plan N, the second most popular plan. High deductible Plan G, the third most popular plan. If you have questions, if you want a private consultation with our team at the Medicare Family, or you know you want to change your Medicare supplement plan, you want to see if you can find a better rate, or you're just getting ready to go on Medicare, book a free appointment on our website, themedicarefamily.com. We're licensed in all 50 states. Our services are completely free. We represent dozens and dozens of insurance companies as independent contractors. So they pay us, and you don't have to. If you learned something today, please hit the subscribe button. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.